Right. I am so happy to have this chance to share with you an overview of the global health electives that we're excited to be offering this coming spring. And before we go through the specific electives, I just want to introduce you to some important dates. The application deadline for receipt of all components of the application will be the end of the day on September 1st. And please keep in mind that there are three options for interviews. We're going to try to interview most folks on Saturday, September 9th. But for folks who can't be accommodated on those days or are not available, we'll be doing interviews on the subsequent Thursday afternoons. It's our great hope that we'll be able to send out final notifications to you by mid-October. And there are two important dates for you to keep in mind that are mandatory. Those folks who are participating have a mandatory pre-departure orientation program on Saturday, February 10th. This is an all-day in-person orientation. And then the day before graduation on Thursday, May 30th from 12 to 2 p.m., we'll all be getting together to share feedback with one another from these experiences. So here is a summary of the elective opportunities for your class. There are opportunities in Asia, Africa, North America, and South America. And we're going to start with Africa and Lilongwe, Malawi. Now, the rotation dates for most of these electives will be the first 3 weeks after match day. The exceptions to that would be the electives in South Africa and Mozambique. Those three electives are scheduled for the subsequent 3 weeks after match day. So all of the others are the first 3 weeks after match day. So depending upon where you're going on Friday night after match day, you may be off to LAX or possibly Saturday morning if you're not going quite as far. So let me tell you a little bit about the opportunity in Malawi. And we have a long-standing relationship, a partnership with an NGO there. It's a faith-based NGO called Partners in Hope. And for those of you who are familiar with our internal medicine residency program, know that there's a long-standing partnership with internal medicine residents and faculty members going over there with great frequency. It's likely that you'll be there with internal medicine residents and hopefully for at least a portion of your elective with an internal medicine faculty member as well. Now, the clinical experience has a very heavy focus on patients with HIV/AIDS. It's mostly an outpatient experience, but you'll do some inpatient medicine in their adjacent hospital. It's mostly an adult experience, but you'll also see some kids. Most all of the patients will have HIV or AIDS, but you'll also be addressing other healthcare issues. And during the rotation, you'll have an opportunity to visit other health centers and a huge public hospital in Lilongwe. If you're interested in learning more about the Malawi experience, you can watch Chantel and Han, who share their reflections on the website to learn more about the experience through their eyes. The next elective opportunity in the region is in Maputo, and note that this one is the second 3-week period after match day. And I established a partnership in Mozambique probably 13, 14 years ago. And when I first visited Mozambique, for the 10 million children in the country, there are only 10 pediatricians in the entire country. There were no pediatric surgeons. They were just training there first. There were only 2 pediatric ventilators. And the country had a huge shortage of healthcare workers. After their independence from the Portuguese, there were years of civil war, and they just didn't have physicians in the pipeline, folks going to medical school. This experience in Maputo is primarily centered around pediatrics, and it is a Portuguese-speaking country, and fluency in Portuguese is not required to participate. However, being conversational in Spanish is very, very helpful. And one of the amazing highlights of this rotation is the opportunity to work with Dr. Chris Buck. Chris is a UCLA faculty member who is based in Mozambique. He is in the Department of Pediatrics here at UCLA, and he oversees the whole training partnership and also our research collaborations. The rotation takes place at a huge public hospital. It's the main referral hospital in the entire country, adjacent to really the most prominent medical school in the country. The central hospital there has 1,500 beds, with an average daily census in the rainy season of about 3,000. So it wouldn't be surprising if you see patients that are doubled up in their beds. And in pediatrics, that usually means 2 babies and or toddlers and 2 moms sharing a bed. You will spend time within the children's hospital, which is on the campus. It's almost like the VA campus here, in that there are multiple buildings spread out on the campus, and the children's hospital is quite large in itself. And you will work with Chris Buck in this setting, and he is a master teacher and an incredible role model for humanism at the bedside. Chris will also facilitate opportunities for you to rotate on different wards. He works on a ward called Lactentis, which is for babies under 1 year of age. You'll see incredible infectious diseases there as well, and you'll also have an opportunity to visit an outpatient setting in which Chris cares for children with HIV/AIDS. You can see on the map there, Mozambique is a very long country, but for perspective, that coastline is longer than the west coast of the United States. So it's longer than San Diego to Seattle, and they're beautiful beaches. The coastline is quite spectacular. All right, Cape Town, South Africa, same dates as Mozambique, the second 3-week window after match day. And this rotation takes place at Somerset Hospital. Somerset Hospital is a major teaching hospital of the University of Cape Town School of Medicine. And when we started this partnership years ago, we only sent students to the emergency room, and the partnership has grown. And in addition to the ER experience, which is amazing, you can choose from a wide range of other specialties, including pediatrics, internal medicine, OBGYN, and psychiatry. This is a mid-level hospital. It's not the tertiary quaternary care hospital at the medical school. It feels a bit like Harbor UCLA to me. And in fact, the emergency department is just like it. Harbor, it's a relatively new emergency department attached to a relatively old main medical center. And we send anywhere from 6 to 10 students per year to Cape Town. And students usually rent Airbnbs in the area, rent an apartment in neighborhoods that you would check out with us first before renting. So this is really a phenomenal opportunity for students, and it's one of our longest standing elective opportunities. Also in South Africa, but in a very different region, is the experience at Messaleni Hospital. You can see on the map, here's Cape Town, and all the way across the country is Messaleni Hospital. This region of South Africa is called KwaZulu-Natal. It's one of the poorest regions. It was where Nelson Mandela was raised. It's also the region of South Africa with some of the highest rates of HIV/AIDS. And it's actually not very far from the Mozambique border. This is a pretty unique experience. Students will fly in together into Durban, and you can see Durban here, and it's about a 4-hour drive to get to the town. And the hospital is a first-level hospital, and it is staffed by family physicians who provide really incredible and broad care, both inpatient and outpatient. These folks are like super docs. When they took me on a tour the first time and they showed me the operating room, they said they do minor surgery, but they also do amputations, lots of diabetic limb disease, and they do cesarean sections. When I asked them who does their anesthesia, they looked at me and said, "We do our own anesthesia." So they do the anesthesia, they do the C-section, they resuscitate the baby, they're running codes, they deal with trauma. It's really an incredible experience. And the teaching has been quite strong there. But it takes it's a very different experience than Cape Town, where you're in the big city. Here, you're in a rural community. Students usually, or have in the last couple of years, stayed on the coast in a nice little town, and it's about a 20-30 minute drive. But the students, usually four, will arrive in Durban. We'll rent a car, maybe a stick shift. It's much less expensive than an automatic, but you could rent an automatic. Remember, you're going to be driving on the left side of the road, and you're taking off 4 hours into the bush to the clinic. So it's quite an adventure and a very exciting one. And if you're interested in Messaleni or interested in learning more, you can watch a video that Boris and Anana recorded where they share their reflections. And you could see this on the Messaleni site description on our webpage. All right, we're going to a very different portion of the world. We're off to Asia now, and the rotation in China takes place at Zhejiang University, which is located in Hangzhou. It's about 2.5 hours southwest of Shanghai. It's a relatively big city, so you can fly directly into Hangzhou, or you can fly into to Shanghai and take a car, get picked up, or take a train to Hangzhou. Now, this is a huge urban city that's quite sophisticated, and I mean, the medical system is quite sophisticated. And Zhejiang University School of Medicine has multiple teaching hospitals. The one that our students usually go to is called Second Affiliate Hospital. And this is how the 3-week rotation is broken up. The first week, our students all engage in traditional Chinese medicine. The second week, you can choose to spend time in a service that you're most interested in, or likely that you're going into. A fair number of students have really enjoyed the traditional Chinese medicine, so they've done 2 weeks on the TCM service. And then the third week, you will leave Hangzhou with a couple of Zhejiang University medical students who are bilateral, and they will take you to have an experience for a few days at a community clinic. It's recommended that students who participate in this have some proficiency in Mandarin, but it's not absolutely required. Non-Mandarin speakers have participated, but they have faced some challenges and have really needed to have the other students at their side to be helping with translation. The amazing part of this is that the folks at Zhejiang University provide free housing for our students. It's either a dorm or an apartment a few blocks from the medical center, lots of eating establishments nearby. And if you are interested in learning more, you can check out the site description online and watch Charles and Dominic, who shared their reflections on their experience. Right. Also in India, there's an experience in Mumbai, and this one also takes place in the first 3 weeks after match day. It takes place at King Edward Memorial Hospital, which is a massive public teaching hospital in Mumbai, associated with a very academic, top-tier medical school in the city. And you can choose to rotate on the medicine service or on the pediatric service. And there will also be opportunities for you to visit some other hospitals and get a feel for other healthcare systems in Mumbai. This rotation is really thanks to an alumna of the medical school, Dr. Rati Godrej. Went to UCLA undergrad, and she did her medical school here at UCLA and then trained at Cedars in internal medicine. And she married a man who lives in Mumbai with a family business there. And they raised their 3 sons here. They have traveled up and back quite often to the States. All 3 sons went to Stanford, and Rati's immediate family still lives here in LA. So they travel quite a bit. When Rati first got settled in India, she started working for the US consulate in Mumbai as the internist. And then in recent years, she's been participating in projects in Mumbai with the Harvard School of Public Health. And as her gift to the medical school, she has taken on the experience, and she takes amazing care of folks, including offering an extra apartment overlooking the sea in Mumbai. And if you want to gain a firsthand view of the experience, please zoom in and watch the video that Cody and Vikram recorded a couple of years ago. The students who went this year had an equally amazing experience. All right, in the Middle East, a new one, and that is in Lebanon. And we're so excited to be able to offer this experience in Beirut, and we'll soon be having students from the American University of Beirut joining us here. The dates are not officially confirmed, but it's likely going to be that same first 3-week period. The Faculty of Medicine at the American University of Beirut has an adjacent affiliated tertiary care regional referral center, and you could rotate on numerous specialties. You can do anesthesiology, pathology, derm, radiology, emergency medicine, family medicine, internal medicine and subspecialties, OBGYN, ENT, pediatrics, psych, and surgery and its surgical subspecialties. And you'll also have the opportunity, if you'd like, to engage with patients in a variety of community health centers. Being familiar with Arabic would be very helpful to facilitate clinical encounters, but it's not mandatory. Efforts will be made to pair UCLA students with AUB students to facilitate communication in Arabic. All right, and then the last experience opportunity in Asia is in Thailand, in Bangkok, and there are 2 sites in Bangkok, and the first one is Sirarat, and the next one is Thammasat University Hospital, which is part of the Chulalongkorn College of Medicine. We have been sending folks for many years to Sirarat. Last year, we had a huge number of students who wanted to go to Thailand, and the folks at Chulalongkorn were able to accommodate them. And the students at both sites had really a very strong experience. It's a little bit different, and there's somewhat different offerings. So Siraat is one of the oldest and most esteemed medical schools in the country, provides really an excellent clinical experience. There's a very strong emphasis on teaching, and unlike some of the other rotations, language will not be a major barrier, as you don't have to speak Thai. The majority of attendings and residents are proficient in English. Patients may not be, but they've been quite amazing translating along the week. Now, the first week, the students at Siraat will have the unique opportunity to be exposed to traditional Thai medicine and Thai massage. You'll all have Thai massages. Siraat has its own dedicated massive center on the campus for traditional Thai medicine. And then after that, you can elect to spend time with the adult infectious diseases folks, or you can spend time with the pediatric infectious diseases folks, and have opportunities to be exposed to a wide spectrum of pathology, dengue, fever, leptospirosis, TB, COVID, opportunistic infection secondary to advanced HIV and AIDS. And it's possible that you can have experiences for a week in other subspecialties, but everyone's going to do traditional Thai medicine. Everyone's going to do a week of either peds or adult infectious diseases, and then we'll work out the third week for you. And if you're interested in learning more about this, there is a video from Jody, Ayman, and Eviola, who shared their impressions. Now, Chulaborn, I've not been to. Tracy did visit Chulaborn this year, so she can give you more firsthand scoop. This takes place at Thammasat University Hospital. This is a busy tertiary care government hospital, but it's in a suburb. It's about 20 to 30 minutes outside of Bangkok versus Sirat, which is more in the city. There is a shuttle bus to Bangkok if the students, if you choose to stay closer to the city center, but there's also affordable short-term housing close to the hospital. It's supposed to be a beautiful setting, excellent teaching in a variety of specialties, except there's no peds and there's no OB. So if you're interested in peds or OB, then and you want to go to Thailand, then Sirat would be your first choice. Students also at Chulaborn Thammasat will spend 1 week with integrative medicine, which includes both traditional Thai medicine and traditional Chinese medicine. So one of your weeks will be in traditional Thai medicine, and then you can have opportunities to rotate on other teams, except for peds and OB. And now we're moving to Latin America. The experience in Tijuana occurs in the same first 3-week period after match day. And this experience involves working with Refugee Health Alliance, and this is a non-profit organization known for its incredible work across the border. The location sees significant number of folks who are immigrating from various parts of Latin America who get stopped at the Tijuana U.S. border. But there's also a notable presence of Haitian refugees, for any Creole speakers out there, and also immigrants from sub-Saharan Africa. The NGO provides housing and primary medical care for large communities of the refugees, and this experience offers not only hands-on clinical work, but it's really a phenomenal opportunity to learn more about refugee health issues and contribute to advocacy efforts to facilitate folks crossing the border for medical care. Conversational Spanish skills are required for this experience, as it involves interacting with the local populations. One of the founders of this nonprofit is an emergency medicine physician at Harvard UCLA, who still works in Los Angeles and commutes to support the organization. And in this setting, you will work with both American and Mexican physicians. All right, Porto Alegre, Brazil. This is in a rotation in the far south of Brazil. It's between Sao Paulo, Brazil, and Buenos Aires, Argentina, and not too far from the Uruguay border, as you can see, just to the southwest of Porto Alegre. Although this is a Portuguese-speaking country like Mozambique, the experience is supervised by English-speaking physicians, and you'll be teamed up with English-speaking medical students. And the leadership there is very dedicated to providing a great experience for you. And they in turn have a lot of experience working with many English-speaking rotators from around the world who didn't speak Portuguese. Last year, we were unable to offer the elective rotation in Peru due to political instability in the country, and most of the students who were going to go to to Peru instead went to Brazil, and they had a great time. Now, our very new rotation, the two newest are Lebanon and Quito. A group of us were in Quito last month to finalize details for one of our newest rotations, again, the first 3 weeks after match day. And this occurs at Universidad San Francisco de Quito, University of San Francisco, Quito. And this is a private university, but it's really with an excellent medical school and a very strong global health program. And this rotation has multiple options for you. If you would like to stay in the city and have an urban experience, you can go to one of two public hospitals. There's a public hospital that has all the services except peds and OB, and then there's a maternity hospital that we didn't see. The public hospital, though, is impressive, and really impressive were the folks that we met at the children's hospital, there. So you can work at one of these large public tertiary level hospitals in Quito. The children's hospital, by the way, is one of two in the whole country. The other one is in Guayaquil. Or you can have more of a community experience, and there are a couple of community health centers. We'll work one-on-one with an attending physician and a local medical students, and they're not so far. They're commutable by bus, and the local medical students, most of them would take the bus in and out every day. And proficiency in Spanish is also required for this experience. So you're going to be rotating in some busy public hospitals or busy public clinics. And for housing, the team there can arrange short-term housing or help facilitate connecting you with short-term housing options, but they also offer a homestay program, and their medical students participate in the homestay program. And last but not least is the experience in Iquitos, Peru. This partnership I established about 10 years ago, so we've been going there quite some time. Here's Lima, and then it's about a 2-hour flight northeast to Iquitos, not far from the Colombian border. And Iquitos is described as the densest city in the world with no road access. It's completely encircled by the Amazon, so the only way in is by boat or by airplane. And there are about 500,000 people living on this island, and areas of the island are quite dense, with slum communities built on stilts on the Amazon. But the public hospital there, the Hospital of Loreto, which is that northern region of Peru, is also a referral hospital for the whole northern portion of Peru, and it's quite a rural population. So imagine branches of the Amazon, and then smaller branches, and even smaller branches. Some of the patients may travel for 2 weeks to get to medical attention in Iquitos. Some of them don't speak Spanish. They may be Quechuan speakers, so there'll be translators from Quechuan to Spanish. Now, you'll have an opportunity to work on either the pediatric service or the adult ID service. In both cases, there's lots of infectious diseases. You'll see tropical diseases, malaria, dengue, and a fair number of snake bites there as well, because kids and folks are swimming in that water all the time. The elective is supervised by an adult infectious disease specialist on the medicine side and a general pediatrician on the pediatric side. Proficiency in Spanish is really essential to make the most out of this experience. Now, there are a couple of videos that I want to tell you about. Before the pandemic, the Today Show traveled with us to Iquitos to try to capture the spirit of the DGSON medical student experience in that setting. And in the email message that we're sending out to you, describing all the options, I will include the link for that video. It's just a 5-6 minute video, but it will give you a good feel for what the setting is like and the actual hospital environment is like. There's also another video link that I'm going to share with you, and Dr. Godrej in Mumbai has a cousin who is kind of an amateur documentarian, and she created a 1-hour documentary on King Edward Memorial Hospital. And so even watching just a little bit of it, you'll get a feel for what that setting is like and what it would be like to rotate there. Now, a little bit about the level of hands-on experiences in these settings. That will vary. And zipping around the world in Asia, the experiences in Thailand, China, and India will largely be observational. Part of that, a lot of that is due to the language barrier. In Lebanon, you will have an opportunity to do clinical work, and those interactions with your peers will be in English, although Arabic is a bonus. So in Asia, 3 of them are more observational, and the Lebanese experience in the Middle East will give you some hands-on experience. In Latin America, the experience in Brazil will likely be more on the observational side than the hands-on side, because you're going to be because of the language barrier there. But even in all of these observational, though, you'll be very engaged in the clinical work and the clinical setting. You're just not going to have your own patients to work up. But in Peru, you're likely to have patients that you'll be rounding on. In Mexico, you'll be caring for patients, and in Ecuador, you'll be caring for patients. In sub-Saharan Africa, Malawi, you'll have lots of hands-on experience, both South African experiences, the emergency department and other specialty rotations in Cape Town, a lot of hands-on, and lots of hands-on at Messalini Hospital in rural KwaZulu-Natal. The Mozambique experience in pediatrics will likely be more observational, but rounding with Chris Buck will be translating for you along the way. And the infectious disease and general medicine experience in Malawi will be hands-on as well. So different settings, different levels of hands-on engagement, different language requirements. The experiences in Mexico, Peru, and Ecuador require Spanish speakers, at least conversational Spanish. So that's a whirlwind overview of the opportunities. I actually just finished up the 2-hour session with you folks on residency applications, and another 30 minutes now. So I'm going to take a break, and we look forward to answering your questions, and really excited for you to have this opportunity to participate in these electives. Have a good one.